No. Managed to convince you.
Exactly. But I'm feeling for it.
Yeah. I will show it. It's 1:30 now, but maybe we'll leave it a couple more minutes to see if anyone else is joining this afternoon. If no one else does, would people mind moving into the middle, maybe, so we can have a bit of a discussion? Yeah. Hello. Leave it another 60 seconds, and then after I think it's off. Okay, let's begin. Welcome to this afternoon's session on subnational government leadership for sanitation, experiences and learnings from East and West Africa. My name is Jamie Myers, and I'm a researcher based at the Sanitation Learning Hub at the Institute of Development Studies in the UK. And this session is a collaborative effort between the Sanitation Learning Hub, the Ministry of Health in Kenya, Siaya County, Kenya, United Purpose, and UNICEF. And we're here to share some findings from a piece of research we undertook, which involves all those organizations just mentioned and a bunch of other local governments. So it included Ndali commune in Benin, Yendi municipality and in Ghana, Malato commune in Guinea, Logo local government area in Nigeria, Siaya County in Kenya, I can never pronounce this one, Emma, you might need to help me. Nyamagabe district in Rwanda and Moyo district in Uganda. And I'm going to kick us off by giving us an overarching presentation. We then have three of those districts presenting, so we'll learn a bit more about the depth, about the findings from those particular districts. Great. So the session objectives is to share findings from a research process we undertook into subnational government leadership for sanitation. Also to highlight the barriers and enablers to subnational government leadership and how we can support governments to prioritize sanitation. To increase understanding of actions to support subnational government leadership, to hear from local government and development partner stakeholders, and also hopefully to hear from you. So we've got some group work planned. We may end up doing it in plenary for a smaller group than we anticipated, but we'll work that out later. Yes, so I'm going to give a brief overview of the research and some of the overarching findings. We then have presentations from the subnational governments and development partner team. So we're going to hear from Siaya County in Kenya, from Nyamagabe district, Rwanda, and from Logo local government authority in Nigeria. We will then have some discussion to kind of explore your experiences in supporting local government leadership for sanitation before having some feedback from the group work and wrap up the next steps. So before we go into the presentations, I wanted to show you the questions we're going to ask you to be considering during the group work. So I want you to be kind of thinking about these questions as we go through the presentations. So we're going to be asking you to consider if you find the findings we've found resonate in areas of your own work. If not, where are there differences? What other ways have you found to engage subnational governments successfully on sanitation? And what action should we recommend to strengthen subnational government leadership for sanitation based on the findings and based on some of the work and your own experiences? So I can leave that up for a couple of seconds, get the brainwaves flowing, but do think of, I'll obviously put these up when we do the group work, but I just wanted you to be considering these throughout the presentations. So I wanted to say something about the rationale. Why would we focus on subnational leadership for sanitation? So if we are to reach everyone with improved WASH, we need to understand and strengthen the wider context in which services are delivered. So the social, political, environmental, institutional, financial, and technical. But what does this actually look like in practice? I'm sure you're all aware of several WASH system strengthening and enabling environment frameworks and building blocks and all the other things we have in the sector. And here are just a few examples of them there. However, we found when looking for practical examples is that they either focused on the national level or they focused on water. And we found a gap in kind of how these building blocks were being considered and implemented at a subnational level with regards to sanitation. And with many countries going through a decentralization process, we know that lots of local governments are the ones who are mandated with actually delivering the sanitation service. So we're particularly interested in looking at examples where local governments had taken a leadership role and then working backwards to see how that leadership was galvanized and what are the kind of practical implications of that. So the methodology, we've run 2 rounds of this research so far. The first was with subnational governments and development partners in Kenya, Rwanda, and Uganda. The second was in West Africa. So we were working with Benin, local subnational governments in Benin, Ghana, Guinea, and Nigeria. With each round, we first reached out to development partners to ask them if they'd had any experience of working with subnational governments that had shown a kind of increase in the leadership or prioritization of sanitation in recent years. And we're particularly interested in that lowest level of subnational government that still has the power to make decisions, to allocate budgets, and those who are very much mandated with managing these services. Sorry, I'm forgetting my clicker. We then supported each development. We then asked the development partners to create a case study development team with the local governments themselves, and to develop a case study of their experiences. So each team used a similar case study development guide, drawing on to participatory monitoring and evaluation processes. So the first was most significant change, and the second was outcome harvesting. So we first asked teams to consider what change they'd seen in the prioritization of sanitation and hygiene at the subnational government level, and then asked them to work backwards to consider what had contributed to the change. By first asking who has been influenced by the change, what have they changed, when and where was this change, what has been done differently that's significant, how, if at all, did development partners contribute to this change, and what did they do that influenced this change? So there was a list of questions that were answered by these case study development teams and they had to provide evidence for each of those questions. Okay, so once these case studies had been developed, we brought these case study teams together in a series of three-hour online workshops. So we planned to do this prior to COVID, and so we'd adapted what we planned to do in a digital, virtual way. So the idea was initially to have a 5-day local government workshop, but then we adapted it to do it this way. And so during the three-hour workshops, the idea was to share experiences, cross-analyze the cases, draw out some of the common themes, barriers, and the emerging recommendations. So the first workshop focused on creating a safe space for honest reflection. Each case study team introduced their case study, and we started drawing out some initial analysis and identifying common themes. The second workshop was very much delving into these common themes, and the final workshop looked at drawing out some of the lessons learned and recommendations. So following the workshop, we drew discussions together in a learning brief. So there is a learning brief for both the East Africa and the West Africa one, as well as presenting findings in spaces like this. Okay, so there were 4 major emerging themes. The first was around building and maintaining political will. So key enablers across countries, including having a supportive national policy environment, engaging both elected officials and technical staff, using data strategically to speak to different stakeholders' interests, and including sanitation standing agenda items in meetings to kind of maintain a focus over a longer period of time. A key barrier everywhere was around the challenges associated with maintaining progress and commitment across political transitions and with staff rotating. A second theme was around using data strategically. As I've mentioned, this was important for gaining and maintaining political will. As you would expect, data was also being used to inform program design and to advocate for resources, and learning activities were also noted as supporting these areas, as well as supporting implementation quality and motivating staff and officials to continue engagement. There was a third theme around resource commitments, which you can imagine is a common challenge. There was some progress in the form of including specific sanitation lines in budgets and maintaining certain amounts, ring-fencing certain amounts to spend on sanitation. However, these were often diverted in many cases, or redirected, or ended up being released at a later date, which made programs which made it challenging to implement programs. The final theme was around leaving no one behind, which was essentially quite a big gap. CLTS was cited as something which aims to cover everyone within a particular community. So that was used also often as a way to say we leave no one behind, we do CLTS. But there was nothing at the subnational, but none of the subnational governments had kind of concrete actions beyond this, although some had ideas of ways to engage those who may be left behind. These were not yet tested, but included fostering LNOB or Leave No One Behind champions and developing better ways to identify those who may have been left behind, as well as allocating budgets for Leave No One Behind initiatives. So the full findings from both these rounds of research are available on our website, and I can provide links and information about that later, but I'm keen to hear from some of the districts themselves. So we have 3 presentations. We ideally wanted all 3 presentations to be done in person due to visa issues. We were only able, well, we're very lucky to have Emma Mwende and Mabel Chanzu from the Ministry of Health in Kenya with us today, but we have recorded presentations from both Rwanda and Nigeria. So I think the best way around to do it is to have a recorded one and then a physical one, then a recorded one, so we don't all fall asleep from watching too many videos on the screen. So let's first hear from United Purpose in Nigeria. Unless you have any, we could do, I was thinking we could do a Q&A, we could do a short Q&A after, but if you have any questions now, I'm also happy to answer. So let me play. So this going to be hearing from Shadrach, who works for United Purpose and has been working with Logo LGA.
Hi everyone, my name is Shadrach. I work with United Purpose Self-Help Africa, a UK-Irish organization working in about 20 countries, including Nigeria. I work as a project manager and assistant head of programs. And today I'll be presenting the case study of Logo local government area, Benue State, Nigeria. I'll take you through the background and issues, the positive change, contributors to the change, barriers to the change, reflection, and way forward. Logo local government area is located in Benue State, north central Nigeria, and it is one out of 774 local governments in the country. There has been good momentum building for sanitation and hygiene, mostly at the national level through the Ministry of Water Resources. But this has not been commensurate at state and LG level. So you see that discrepancy in level of political and government commitment, between the national and the subnational level. The specific situation at the local government, before the intervention, the washing it existed in the local government, but had very few staff and low capacity. There was minimum funding from the local government authority to the wash unit. And there were these issues of a bit of complexity in financial management, where the signatories to the wash unit, who were top government officials at the local government, would be transferred, and that will cause some delays. And lastly, this case study is taken from a program that was funded by Water Supply Sanitation Collaborative Council, WSSAC, now known as Sanitation Fund. It was a 7-year project, about $7 million, and ended in 2020. This case study was taken in 2021. Positive change. Logo became the first local government in Benue State and North Central Nigeria, and the 7th in Nigeria to be declared area-wide ODF, or to attain area-wide ODF status. The wash unit was revamped. Additional staff were sent to the washing unit, seconded from other departments of the local government to the washing unit. There was office equipment, boards, vehicles also donated to the washing unit for to support them in activities and monitoring. There was intermittent release of funds by the local government authority to the wash unit. And after attainment of ODF status, this achievement was used as an advocacy tool to the state government, which led to the release of $195,000, which was allocated to 3 additional local governments for sanitation and hygiene or ODF activities. The traditional council became really active on sanitation and hygiene issues, mobilizing their constituents, putting in bylaws against open defecation and holding government accountable to their responsibilities. The involvement of traditional leaders also eased the financial procedure by making one traditional leader a signatory to the account. It filled in the gap where a government signatory is transferred. So contributors to the change, there was more of downward push from the state level technocrats at the state agency for rural water supply and sanitation to the local governments, more than the political championing from the local government. So there was more of state level influence in bringing about this change. Similar to that, at the state level, there was a solid sanitation hygiene improvement plan and minimum standards and requirements for participation by local governments, which was also inspired by the donor minimum standards. So the local government was forced to invest, to make certain level of investment before any project will be done there. There was also funding from WSSCC, and United Purpose provided that technical support in execution of the project. So there was a staff of United Purpose embedded in the wash unit, providing mentoring and hands-on support. The wash unit was directly linked to the state agency, and there was a ring fencing of funds from the state government to the wash units directly to avoid reprioritization by political leaders. The traditional leaders were also very active, as stated earlier, in mobilizing, holding government to account, advocacy. There was trainings, capacity building support that was provided by the RUASA to the state agency now, to the wash unit. And also we recognize the fact that activities of NGOs like Water Aid before this intervention had set a background for the change. So barriers to this change, first of all, is inconsistent government funding. So even though government made certain commitments and intermittent releases, this was not consistent. Consistent political leadership at the local government level. So the local government system basically in Nigeria is very, very unstable and mostly controlled by the state. So you have a political leader that buys into the idea of sanitation and hygiene, starts making commitment, and shortly after that, the tenure finishes and new leadership comes in, and advocacy efforts will begin from scratch. So conflict and insecurity made leaders, traditional and political, to prioritize security issues, basically, which included moving of funds to that, and rather than sanitation and hygiene. And there was the limited influence of the traditional authority. So even though the traditional authority had this level of influence and that brought about positive change, they couldn't influence everything. So for instance, they couldn't do much about institutional sanitation facilities like washing schools. So that kind of limitation. So quick reflection and way forward. There there is need, for instance, in Nigeria, there is need for a very strong state level system that will provide good leadership to the local government, strengthen the local government system. Since we are aware that the local government system is a bit weak in Nigeria, a strong state level system will provide a push for sanitation and hygiene. And then access to funds for sanitation and hygiene could serve as an incentive to make the local government also commit their own funds. So for instance, if there is a federal government or state government program or donor funded a program, that could serve as a bait to make the local governments also contribute or make their own commitment. The traditional authority are very strong in Nigeria and can be utilized to mobilize their constituents, hold government to account, and bring about a positive change. There needs to be a clear plan of engagement, especially at the state level, providing a proper guidance and leadership for the local government to be able to participate, to be able to buy into the plans and then participate. And then results or evidence-based advocacy. So example of the fact that we use Logos attainment of ODF to get the government to make more a release or commitment of funds. When you have like pilot projects and they're able to demonstrate results, those projects can be used as an advocacy tool to bring governments to commit more. Thank you for listening.
Thank you, Shadrach. Give a round of applause for Shadrach there. Great. So I'd like to now invite Emma up to talk us through the Kenya example.
Good afternoon, everyone. Yes, my name is Emma Mwende, working as a monitoring and evaluation officer at the Ministry of Health National. Previously with the Siaya County, I'm sure it's reading Siaya County and I'm from the national, but previously I was the monitoring and evaluation officer till the county achieved or attained open defecation free then. And I'm here with Madam Mabel Chanzu, who is the county public health officer for the county and will be giving more insights toward the end of the presentation. So Siaya County is one of the 47 counties in the country and has a population of close to 1 million, according to the last census in 2019, with 2,245 villages. Looking at the population there is that 91% of it is living in the rural areas, while 9% is in the urban areas. The county started its journey, open defecation free journey, in 2011 by setting out targets, sanitation and hygiene targets, but was ultimately declared open defecation free in 2018, a journey of 7 years in the making. And it is one of the 3 counties in the country that has been declared open defecation free, so 3 out of the 47 counties. Currently, looking at the status is that the county is implementing market-based sanitation to sustain the gains that were made in 2018 after the county achieved open defecation free. And it continues to strengthen its policy and coordinations through the County Sanitation and Waste Management Act of 2019. Looking at it also, it's one of the 11 counties that is moderately at open that is still defecating in the open. After the census 2019, it was also realized that a population of close to 50,000 is still defecating in the open, meaning that there has been some relapse taking place from the achievement or attainment of open defecation free. So we had some priority areas of change that led to sanitation and hygiene. And one of the key areas was sanitation and hygiene financing. Sanitation and hygiene financing, it's actually a critical area that has been a challenge, that has been posing a challenge in all the counties in the country. But Sierra County made some significant changes in getting financial commitment. And this was largely due to the support that was provided by UNICEF under a partnership with the county government, where there was a process of co-investment and a reimbursement approach modality. So at the first go, UNICEF provided close to 300 million shillings, which is close to 30,000 USD for some stakeholders meetings and capacity building. And thereafter, the county government committed 50,000 USD to continue sustaining the sanitation and hygiene activities in the county. Thereafter, it was more of a reimbursement modality where UNICEF would be reimbursing the county on the funds that the county would be able to use for sanitation and hygiene. Also, financial commitment letter by the county government. A key challenge was that financial resources geared towards sanitation and hygiene were being redirected to other areas of concern, looking at some other interventions that were taking place. Since we did not have a budget line or a sanitation voted for sanitation, then funds geared towards sanitation and hygiene would be redirected. But having a financial commitment letter by the county governor then ensured that sanitation and hygiene funds were purely used for sanitation and hygiene activities in the county. The other bit was performance contracting with the county public health officers in place and also the community health volunteers who were given targets to be able to achieve so that we could have some scale up in the sanitation activities. And this was done annually, where one would be evaluated according to the gains that they have been able to make in the field. The other bit was on political will and commitment. And one of the things that the county government and through the county public health office did is that there was early engagement with the high leadership in the county. This included the governor, the deputy governor, looking at the ministers of health in the county, cascading it down to the members of county assembly who are known in the county government to lobby for budgets, and they are the ones who are involved in providing funds or committing towards county budgeting sessions in the county. Sanitation priorities and also targeting through the county open defecation free roadmap. This was done in line with the annual work plan and also the CIDP in the county. So this ensured that the three documents mirrored each other and we had resources that were being geared towards sanitation and hygiene. So these included key targets of what the county needed to achieve within that period of time. Looking at, again, monitoring and reporting, there was an establishment of a county wash hub, which is derived from the national wash hub in the country. So the wash hub was purely doing activities geared towards monitoring, reporting, advocacy, documentation, and also ensuring that quality assurance activities and CLTS activities were being done as per the target and the targets that were being set for sanitation and hygiene. The wash hub was also instrumental in partnership so that we could not have duplication of efforts, because that is also a challenge that we were experiencing, especially with partners working on the same place other than being diverted or being distributed in all the areas of the counties. Again, looking at strengthened local capacity, county public health officers and community health volunteers were trained on the different aspects of sanitation and hygiene, and more specifically on CLTS implementation, following the CLTS protocol that the county and the country had adopted. So what are the contributors to change in the county? Devolution. The devolution in 2013 ensured that sanitation and hygiene was placed with the county governments, and not only on sanitation or health, but devolution ensured that the county governments were taking initiative of their own activities in the county, but the national government just providing oversight towards the activities being done on the ground. So the devolution supported or assisted to ensure that the county governments were taking ownership of their problems and also now conducting the activities, the actual implementation being led by the county governments and supported by the national government and also by the development partners. Sanitation and hygiene conferences were also instrumental, and here counties and partners were committing towards their ODF targets. The county participated in the first National Sanitation Conference in 2014, and here the county committed to attain open defecation free by 2018, of which this was actualized, and we had the county celebrating in 2018 being declared open defecation free. 2 years after the first sanitation conference in 2014, the country had the CASH policy, which is the Kenya Environmental Sanitation and Hygiene Policy and Strategy, and also had the ODF campaign roadmap. So the county was able to domesticate the two documents, which would also guide the counties in implementing the sanitation and hygiene activities. A prototype for the county environmental health and sanitation bill was also developed at the national level. And Siaya County is one of the 5 counties in the country that has actually domesticated it and have a county environmental health and sanitation bill. Development partners, sanitation and hygiene champions also emerged, which led to contributing towards the significant changes that we had. And this was through the healthy competition taking place between the sub-counties that the county has. So you'd have competition taking place on which sub-counties were achieving ODF, and also through the open defecation free celebrations, which were more targeted. So from these celebrations and also the healthy competition, would have some sanitation and hygiene champions emerging there. And a keynote goes to the county executive member committee of health, who was like we were calling it the Iron Ladies, who were leading the team. So we had the county executive committee member, who was a lady, followed by the county public health officer, who is a lady, followed by now the monitoring teams, which was consisting of a higher percentage of women. So we were calling it the Iron Ladies. So you'd realize that the sub-counties being led by the ladies would achieve open defecation first before the other sub-counties. So this led to a very healthy competition, and by the end of 2018, we were able to declare all. And there was also exchange of learning between the sub-counties. So we'd have the ladies and we'd have now the gentlemen transversing between the sub-counties to just learn from each other and what was happening. Development partners, including UNICEF. UNICEF, we had Kiwash, we had other many partners who were supporting it. So they provided financial and technical support. So these included financial support, providing resources for the quarterly review meetings, providing resources for the movement for the public health officers to move on the ground, and also providing financial resources for the community health volunteers who were given a stipend so that they could be able to sustain the activities on the ground to conduct household follow-up. Technical support, more specifically towards the CLTS approach, and also coming up with the county ODF roadmaps and coming up with the annual work plan. WASH emergencies also played a key role, and this is one of the contributors that we use to lobby the MCAs, the members of county assembly, and also the governor. Siaya County from 2016 was experiencing frequent cholera outbreaks. In a year would have like 3 episodes or 3 waves of cholera. And this is one of the things that we use to lobby for the to lobby for sanitation and hygiene funds. And thereafter, after we had attained the open defecation free, the county has not experienced any wave of cholera outbreak till to date. So that is one of the significant changes that we had. Also having some sanitation and hygiene awareness raising activities, and also the real-time monitoring and information system on sanitation and hygiene. So Siaya County was one of the beneficiaries of the new system that we had then in 2016. It was one of the 2 pilot counties that were able to use the system, and from there on, we're able to cascade it to the different areas of the country. So using that system, we're able to monitor the CLTS activities and also monitor the gaps that have been there. And to date, we are actually expanding it. It's no longer going to be the CLTS reporting system, but rather sanitation and hygiene platform. The challenges that we were experiencing then, we had some competing health priorities for funds and redirecting of funds. I mentioned about the cholera outbreak. So anytime there were outbreaks, then the resources will be diverted towards combating the cholera outbreaks and any other engagement that the county had. Remember, sanitation and hygiene did not have a vote head or a budget line. So it was being merged or being placed under the health department activities. So anytime there was any other activity, the resources will be diverted. Also changes in leadership. With the frequent changes in leadership, the transition becomes a challenge since every new leader comes with their own priorities and targets. But from the letter of the governor protecting the redirection of the funds and also commitment letters by the predecessors before the other come on board, it supported some of these things. Hard to reach communities. Siaya County is one of the counties in the Nyanza and Western region that has a population along the beaches, and the communities along the beaches are hard to reach. Looking at the migration patterns during fishing, and also in terms of they are more of a nomadic lifestyle for the fishermen. So these were some of the hard to reach communities, and also the areas are prone to flooding. Some of the areas are prone to flooding. So you'd find that some of these communities were very hard to reach. Leave no one behind. It affected the sanitation coverage since we had a challenge. And looking at the relapse that I mentioned earlier of around 50,000 people, it is being attributed to the hard to reach populations due to the movement and migration. Sustainability was also a challenge in the county since the post-open defecation strategy had a low start, and this was also coming in from the higher levels of the government, including the national, where we are yet to have a national post-ODF strategy, which can be able to be cascaded to the ground. So that is still a challenge that we are facing, but more and more partners are coming on board with different market-based approach solutions that can be able to do that. Limited staff due to different health portfolios. Looking at the lowest tiers that we have, that is the community health volunteers. The officers or the volunteers are used or participate in different health activities. So not only on sanitation and hygiene, but on other health activities. So if it's an activity for malaria or any other activities, they are being they support this activity. So it led to some limitations when it came to sustaining or even implementing the CLTS activities. Some of the takeaways that we had from these discussions is that sanitation and hygiene prioritization led by subnational government is key. And this is very key towards when it comes to committing of resources, providing staff who can be used to do the implementation, and also providing continuous oversight. Also, the national government comes in by providing an enabling environment. Secondly, is that capacity building for the subnational governments supported by the development partners is vital in the achievement of sustainable results. And this is due to the lack of capacity, maybe at the county government level, and also the limitations of time to plan, time to re-strategize, time to have clear targets, and having clear targets in sanitation and hygiene, and also the finances, resources, and also when it comes to monitoring. So the development partners come in very keenly to support or to strengthen the local capacity, also to provide financial resources towards trainings, core investments, and also leveraging of resources. Area-wide programming to ensure that no one is left behind can only be possible if we have monitoring systems or monitoring channels in place where we can be able to identify the gaps earlier enough, and also ensuring that coordination is in place. So this ensures that tracking of target results and identification of gaps is identified way early into the programming before it comes to the end of the program where you realize you have some challenges. Looking at emergence of sanitation and hygiene, this requires motivators, and these motivators can only be present if there is an enabling environment at the social, economic, legislative, and also political environment. Also, the ODF celebrations and other celebrations are very vital when it comes to emergence of sanitation and hygiene champions. What is the recommendations, or where are we? Siaya County currently is implementing a mix of market-based and financing resources. And it's a good thing because looking at the participants here, I can see some of our partners who are supporting us when it comes to market-based sanitation. Also, the county is strengthening and promoting local sanitation and technological solutions so that we can climb up the ladder. So looking at sanitation products and hand hygiene products in the county. Operationalization of the Siaya County Sanitation and Waste Management Act of 2019 plays also a critical role in ensuring that sanitation and hygiene activities are being conducted well. Lastly is on the declaration of commitment signed by the county leadership to ensure smooth transitions. So remember, we had a financial commitment or a declaration of commitment done by the previous governor. And this was more geared towards open defecation free attainance. So we are trying to ensure that we have the same kind of commitment when it comes to market-based sanitation, so that we can have resources geared to that only. The country recently had its elections in August 2022. So we are hoping once the new government is in place, we can actualize on getting a declaration of commitment from the new governor and from the new County Executive Committee of Health. So from this, I'd like to invite Mibol Chanzo so that she can give just a brief highlight on what needs to be done in addition to what I've said. Thank you.
I think Emma has said it all. I don't know why she's called me here. Because we were working together, and I'm happy that our partners are here. And just to mention a few, I'm seeing UNICEF around. UNICEF has been very key. I've seen in market-based sanitation, I've seen, I saw somebody from Finnish. Mondial, yeah, she's there. We really appreciate. So what we may say is that this journey needs collaboration. We really need to put our heads together, our hands together, so that we can move up the sanitation ladder. So we are asking our partners who are here that are not among the ones that I've mentioned to join us so that we may move up the sanitation ladder. But it is very good. You saw the issue of champions. In fact, Siaya County is a county that people borrow and live from. In fact, some of us are very mobile. We are called upon to get to other counties and help them. Just give them motivational talk on sanitation, that we are able to do it. We can, yes, we can. Just like Obama used to say, yes, we can. Sanitation, yes, we can. So we normally move to other counties to really encourage them to move up the sanitation ladder. But we are encouraging all of us to come together, given the challenges Emma has talked about, the challenges of those relapses. In fact, you get the areas that are relapsed, the kind of soil requires maybe a sanitation option that can withstand that kind of soil, which is expensive. So we really need to come together as a team and make it happen. So thank you very much for listening to our presentation. Thank you.
Thank you very much. We have one more presentation before going into group work. I just wondered if anyone had any questions for Emma and Mabel before we move on to the final presentation. Yes, I don't know if we need a mic.
I can speak.
Okay, cool.
No, thank you for this presentation. The question I had is whether you've used this model for other areas of wash and health, given that it could be standard for other areas of change at community level. You thought of, as it is quite comprehensive. I wanted to know if you were working on other areas considering its, I would say, success.
Yes, thank you so much. Actually, we borrowed a leaf from what transpired in Siaya County, and we are having a Kenya Sanitation Alliance, which incorporates 15 counties with the highest open defecation rates in the country, so that we can pull in all the high leadership, including the governors from these counties, and also the ministers and partners in these counties, to ensure that we actually get a commitment towards resources. And so far, we've received 5 commitments from the government, from the governors out of the 15. But the challenges that we are facing is due to the transitions of the government in structure. We were not able to get all the 15 before the elections happened. So for the 10, we'd be starting all over again in doing advocacy so that they can get to the place where the 5 are. But yes, we've borrowed a new from the lessons in that county. Thank you.
So just a heads up to say that I received this presentation 15 minutes before the start of the session. So I haven't watched it in great detail, but it's from the mayor of Nyamagabe County in Rwanda, district in Rwanda, who was also going to talk us through political prioritization of sanitation and hygiene at the local level.
Good afternoon. My name is Hildebrand. I'm the mayor of Nyamagabe district. I will be presenting the prioritizing of sanitation and hygiene in Nyamagabe district. My presentation will focus on 6 points: the district profile, sanitation and hygiene governance, role of WASH stakeholders. I'll be talking about our achievements and subsequent challenges, and then I will round up on it. Our district is one of the 8 districts in the southern province of Rwanda. It is subdivided into 17 sectors, which at their turn are subdivided into cells and 536 villages. We have a total population of 374,098 inhabitants equivalent, and they are all living in 90,198 households. How is the local government sanitation leadership is? In our country, we have the central and local governments. At central government, policies are made. As a matter of fact, in 2016, we had the national sanitation policy, and this policy defines sanitation and hygiene as one of the key pillars to end human security issues. We get targets, and these targets are set at national level. At district level, we have the district council, and this serves as a board of directors. The district council is there to approve the implementation plan and even targets for the sanitation and the hygiene as one of many sectors we have in the district. And then we'll have different partners such as non-government organizations, as well as local civil society organizations. But then after we have this implementation plan, at district level, we have a task force which is responsible for the daily implementation and the monitoring of the sector. Then, as I said, we have 17 sectors, and at sector level, a task force is responsible for operation of sales task force. It's at this sector that we'll be having a digitalized situation room for. As I said, this is a kind of highlighting what I said at the moment. At central level, the Ministry of Infrastructure is leading the sanitation and hygiene. Of course, we will have water as well, water supply. But for the focus of this presentation, I will limit myself on sanitation and hygiene. The Ministry of Health and the Ministry of Local Government are there to back up, to bring in some synergy to the Ministry of Infrastructure. More specifically, the Ministry of Health is specifically focusing on hygiene. Then in the Ministry of Infrastructure, we have the Water and Sanitation Secretariat. For water, sanitation, and hygiene, we have different building blocks, and these building blocks are managed in the Water and Sanitation Secretariat, where all partners are together. As I said, at the ministry level, policy making is made there. And at district level, the secretariat is working hand in hand with the district. And of course, we have international development partners and international NGOs, which are managed under the Water and Sanitation Secretariat, but they can bring in some synergy at the district level. And coordination is also another role of the central government. But at district level, we make a district development strategy. And this district development strategy is approved by the district council. From this strategy, performance contracts are signed between the president of the republic and the mayor of the district. For the sanitation and hygiene part, that's where our targets come in. And the performance contracts are on annual basis. The strategy is for 5 years. Again, local civil society organization and the non-government organization are also operating from the district, and they bring in synergy in the performance contracts. They are supporting the implementation of these performance contracts, which are made at community health clubs for the sanitation and hygiene part. Community health clubs, that's where most of the population at the village level are meeting to tackle and to talk about hygiene. Now, what helped our district to prioritize sanitation and hygiene? We have seen 4 important pillars. The first one is the resource allocation. We started a revolving fund, and this was put in all the 17 microfinancial institutions we have at sector level. And this was a systemic change. Before, our bank we have at the sector level did not have a specific product such as a loan, which was targeting sanitation and hygiene. It's functioning as a loan for community health clubs. It's not for an individual inhabitant equivalent, but it's just for clubs. So they go there, they take loans, and they invest in sanitation and hygiene. Human resources was a second pillar. We have trained more than 2,000 community volunteers, and these have played a key role in championing sanitation and hygiene, especially on the behavior change, but also on the construction of sanitation facilities. The task force, this was achieved by leveraging existing structures we have in our administration, and then appropriate monitoring and collecting data played another key role. This is an example of people of CHC members who are rehabilitating their sanitation facility. They are now preparing mud, and they want to make a very strong superstructure. And this is a second type of superstructure we have. And since this is complete, you see we will also have a hand washing facility to be used after visiting the. In the past 3 years, we have been able to rehabilitate 14,527 sanitation facilities or toilets. And these achievements are different from 1 year to another. This is a kind of the prototype change we need to instill in our community. This is a sanitation facility, but it's not separating the fecal sludge from human contact. But after we have rehabilitated it, we have a strong superstructure, which is this way, and it has a kind of door which providing. We had some challenges. As I said, community health clubs work as a kind of meeting. So during the COVID time, we could not meet. A second one is some of the households are facing human security issues because of their livelihood, and insufficient access to water is another. In the future, we want to maintain the revolving fund, which will improve the livelihood, but also the access to finance for our people. We also need to make a joint planning with our district partners, and we will invest in attracting new partners for WASH interventions. Thank you.
Thank you. So the plan was now to go into some group work with those questions we visited at the beginning. How many of us are there? 4, 8, 9, okay. Well, we could just have a broader conversation then around some of the questions. Let me get up the. So the first one is, do the findings from this work resonate regarding triggering government leadership? And if so, how? Or are we finding differences? We don't have to go do them in order either. We could also have a broader conversation. Does anyone have any experience of working with? Okay, cool. Thank you.
My name is Pamela Bundi from Finnish Mundial, Kenya. I'll try not to be biased because I've worked with a team from Kenya also. But then what I wanted to highlight was there was a mention that the counties in Kenya that are led by women have shown outstanding results in their work in the area of sanitation. But then just to add, that is that in the course of our work in Kenya, because we work in a total of 10 counties, we've seen that the relationships with the persons in charge of the sector make a difference. So when we are moving into a county and the team is open-minded, they're more receptive, results flow faster, the uptake is better, and they embrace especially market-based sanitation, because just to highlight, our work is mainly on market-based sanitation, bringing in the private sector and finance. And the county teams that are more open-minded and receptive, we see that the uptake of these kind of interventions are faster than counties where they are a bit skeptical of the uptake of market-based sanitation. Thank you.
Anyone else have any experience to share? Please go ahead.
Maybe this is more of a question, but so I worked in Tanzania for a number of years, and I was working on an integrated nutrition project, which included WASH. And one of the challenges we had was a lot of turnover in district level staff. So we tried to reverse that by creating mentoring teams, so mentoring from a higher level down to the lower level and providing seed funding. So if that group of individuals came up with some interesting approach or something that they wanted to do, then they would get small amount of funding. I think the results were mixed. I'm not sure we did any better than if we hadn't provided the seed funding. But I was interested in your comment about how do you help, my question is, how do you help SNH champions emerge? So that was one of your bullet points. I'm curious to see, was there something that you did actively to help them sort of rise to the top, or was it a natural process?
For this, maybe I can now to give more context.
So Mabel is a sanitation and hygiene champion
So
from the county, so she might be able to provide
Yeah.
some.
Yeah, the champions, when a champion comes up, we use this champion to help other areas that are lagging behind. And if a meeting comes, like you see, like me, I'm here. I've come to this place just because I'm a champion. So if we get a meeting, we carry these champions to go and get more experience in those meetings. And they also feel motivated. So we normally give them first priority to get to other things. Thank you. And even rewarding, maybe through our partners and even through the government. They give some rewards.
And also through the performance contract, so
Yeah.
those would be able to achieve targets faster than the others, then in terms of promotions and all that, then at least get. And also for the community and volunteers emerging as champions, then during the global days, celebration days for sanitation and hygiene, like the World Day, the Global Hand Washing Day, then they'd be incorporated in these activities. So at least also getting some limelight also from the local government leadership.
Okay, my question. Okay, yeah, most of this work is based in the rural areas, but then you find there are some counties which also have urban centers which are transiting to smaller cities where CLTS or maybe urban sanitation-led, urban total-led sanitation could be applicable. So did you find the same success in the rural areas as these transit towns? And how did you coordinate with the water utilities who are responsible for water and then also for sanitation in those areas, especially seaward sanitation? So did you find success in those urban areas as the rural areas?
So the research very much focused on rural districts deliberately, as could be found, it would be an easier entry point to undertake this initial kind of pilot study. We're also testing a kind of research method as well as a participatory research method to work with both local governments and development partners to reflect on their experience together jointly to see what triggered and changed their relationship with each other and their commitments to sanitation and hygiene, and then to provide evidence for that. So it was kind of an emerging study and the background of the Sanitation Learning Hub is in rural sanitation. So we have so far only undertaken this in rural environments, but could in the future look at ways to get government commitments to urban sanitation as well. But I believe the ship flow diagrams have been used as a tool, almost a triggering tool for urban governments to commit to and kind of take action and engage in citywide inclusive sanitation and sanitation interventions more broadly.
Thank you. So I'm new to WASH. I've kind of moved sideways from maternal health and was have some experience in engaging local governments from the health facility perspective for maternity care and pre and postnatal care. And I was just interested to understand if you engaged at all in relation to health facilities in this work, or if there's any plans to do so.
No, not yet, but could you say something more about your experience with healthcare centres and getting governments to commit to that? Because perhaps we could learn in the WASH sector from your experiences.
Yeah, it was relatively limited. So we were setting up a pregnancy research network in the Gambia, Mozambique, and Kenya. And we needed to work through the health facilities because there was really extensive data collection. And we were setting up kind of a biobank and corresponding data set. But we just found that where we had very early engagement with local governments who oversaw facilities, you know, where it was relevant to their district, we had I guess the strongest engagement with the facility leadership, which I guess did have an impact on how the study was viewed by individual healthcare workers. So it was just helpful to do that from a really early stage, and I guess just felt better as well, having that kind of blessing, I guess, but also that awareness. So we kind of were then able to use that as an advocacy tool for the study and engagement in the study, as well as a kind of permission tool. But yeah, I guess that I'm interested in washing facilities, so I was just interested to understand if that's kind of been considered yet. No, thank you, it's very interesting.
I suppose what we were doing was working backwards, so identifying areas where there'd been an acceleration in ODF rates or commitments of government to either through human resources or public commitments or budget lines, and then working backwards as researchers in a participatory way with those local governments and the development partners to see what changed in the past, rather than trying to set something up for future programming, and then seeing what lessons we could learn for other local governments and how we can trigger other local governments to take more of a central lead in sanitation and hygiene programming. So it's kind of the basis of what we were trying to achieve with both the work in East Africa and West Africa. Wow.
Also a question, and I think observation in general. Did all of these local government had development partners support? No? Yes. So we don't have examples of local governments that didn't have this but still were able to.
No, ideally we would have done it in a face-to-face meeting over we planned to do it over like 5 days in a country, inviting various local governments together. Due to the pandemic and me mainly doing this from my bedroom or kind of my living room, like we had the route in for us at the Sanitation Learning Hub, being an organization based in the UK, was through development partners and where our strongest networks were. So we designed the process based on what was achievable in the given time under those circumstances. But I think that's definitely the next stage, and how we can replicate champions without major inputs from development partners. Something which Shadrach mentioned in his presentation is that United Purpose were working in one of the LGAs. And I don't know if people know the Nigeria context, but it's massive. 180 million, almost 200 million across how many states? 36 states. So let's say it's 36 different countries, I think is the best way to describe Nigeria. Yeah, but so when he was talking about the state, he was talking about that state level rather than Nigeria as a nation state. But yeah, what they did is they supported Logo LGA and then went up to the state government to get resources for other LGAs with less support from the development partner, but there was still development partner engagement. But I'd love to do a next piece of work looking more at less intensive development partner engagement and how to kind of replicate champions.
Just to follow up, is that's something maybe your first question, or that's something we notice, which is when we work in some countries, depending on which development partner was in some local governments or not, you may get different levels of even understanding sanitation, the types of interventions, the resource levels. So I think in this conversation we've been having about putting governments in the driver's seat so that they really lead on these strategies and it trickles down, hopefully, all the way to local government.
Yeah, it's tough. It's really hard. We know we have a master plan, I suppose, in terms of what we want to do in terms of system strengthening, and how, like, part of this was also trying to work out what those building blocks actually mean and look like in reality, and what experiences do we have to date in the sanitation space at the local government level, and where we've seen a bit of progress on this, I suppose what you'd call the kind of enabling block, which is the local government leadership.
Okay, just to add support in terms of involvement of national government leadership. I'm in the academic research, and I'm in the academia, and I do a lot of research with the different countries in the developing world. And one thing that I've noticed, we've noticed as a team, is that if we involve the government from the national level down to the community, then implementing interventions become a little bit easier. And we do this from the inception, like when we're coming up with an idea, we involve the government from the national level down to the community level. And when we do that, then implementation of these interventions and even sort of sustainability and ownership is a little bit of an assurance. And to the Kenyan team, I have a question in terms of, you mentioned that you did your work in 10 counties. Yeah, and if you did this in 10 counties, then I was wondering if you also had counties in the arid and semi-arid areas, and how the approach went.
10 counties, or 10 sub-counties.
I think that was when I was getting to the question that was being asked whether we've replicated it on another side, whether like replicating the same commitments that we've gotten or results from CIA. We are trying to do the same in 15 counties, getting the financial commitments or declaration of commitment from the high leadership. So far we've received 5 out of the 15 commitments. So we are yet to get or to work or advocate in the remaining 10 counties in the ASAL region, because the 15 counties that we are working on with the highest open defecation rates, they are more towards the semi and arid areas of the country. It's only one county that is on the Nyanza Western region, only one, but the 14 of them are towards the northern parts of the country, which is arid and semi-arid. So this includes Turkana, Mandera, Marsabit, or the like.
Okay. Thank you for that. And on that note, you also mentioned about relapse. And I'm imagining like the ASAL counties, and looking at the situation that those counties are in, and kind of seeing some sort of tendency of relapse in those countries. So what are you doing, or what are your plans? What plans do you have to help in like controlling or reducing relapse in such counties?
Thank you. So the relapse was more towards Siaya County, where we, from 2018 to now, we've had some relapse of open defecation, but this is more geared towards the migrant communities, that is along the beaches. But in these 15 counties on the arid and semi-arid, it's when we are doing implementation. And for the areas that we've at least gotten some results towards sanitation and hygiene. And remember, these counties are more of nomadic lifestyle. They move with their animals depending with the climate or how the weather is. So you realize that having having advocated and also created awareness towards sanitation and hygiene, they've become more aware that the moment that they go settle in a new area, especially the communities which are open defecation free, because in these communities, we are working with the communities themselves, not really the whole county, because when they move as a community. So you realize that when they move from one area to the other, they ensure that they establish or they construct some temporary solutions for sanitation and hygiene. So that is also working. So it's something that we've continually created awareness on, and realize some of the leaders, and we actually also use the community health volunteers who are part of the community. So even when they move from one area to the other, the community health volunteer is part and parcel of them. So in such communities, we ensure that we have at least a community health volunteer who's a gentleman, because now it's the men who move and the women remain. So we have the women remaining. So we have a community health volunteer that remains with the community in the village. And then we have a community health volunteer now who goes with the men as they go in their nomadic lifestyles to find pasture for their animals. Okay.
Any other questions or comments?
No, I just wanted to talk about the healthcare waste management. We are also doing it. Remember, we talked about a policy that we developed of 2019. That one is inclusive of waste management in every area, be it sanitation, at a health facility level, we are doing it. And we are looking at a health facility in terms of does it have disposal pits for placentas? Do they have sanitary facilities enough for those mothers? Do they have, is it a septic tank or they are connected to the system? Is it really functional? Is the normal other waste being collected, and where does it go? How do they collect it? How do they transport? To which place do they transport? How do they burn their shops? Do they have an incinerator, or the waste is transported to another facility that has an incinerator? So we are doing quite a lot. It is sanitation in totality now that we are doing in Siaya, just to move up the sanitation ladder. In fact, this other sanitation has come in post ODF. Now we are looking on different areas. And for my brother who asked about the urban sanitation, you know, as we were dealing with the outskirts of these urban centers, but in town we didn't leave them. We divided them into blocks. So we were dealing with them as a block, that they ensure they have enough facilities for their tenants, and for maybe for the general public, we encourage the governments to come up with sanitary facilities in strategic places, so people go there, and it is not free. They pay something for maintenance. So that is how we dealt with the urban center. Thank you.
Any other questions or comments?
Are we still on the last question?
I don't know what question we're on. I think we're having a broad.
Okay, just sharing experience from 2 locations. I work in a regional office where I support some projects in Eastern Africa and also in West Africa. And sharing experience in West Africa, in Cote d'Ivoire, we have CLTS approach where the government has standards or as a policy on the national level, And then you find the support in the districts is very weak. So you find, although they give standards of the kind of sanitation facility which should be implemented in the on CLTS approach, the monitoring by the government and support is not there. So we face challenges where, although we provide incentive, of course, the sanitation facility need to have a slab, then also the infrastructure need also to be sound. Then you find the communities are not able to implement as what we know as community-led. So you find at the end of the day, they need support from donors, and where maybe the donor does or a development partner does the target by the project, you find that is not sustainable by the communities themselves. So at one point it becomes like donor-led sanitation, total sanitation, not the community-led. Of course, our approach is we do the training. We even provide like machines to do stabilized soil blocks. We support them where the soil formation is difficult. Like we provide tools to enable them to do the work. But then there's also cement, especially for stabilization of the soil and also making the slab. But then if that incentive is not there, then it becomes a challenge, especially to continue with the process. So although the triggering and post-triggering and the action plan by the community happens, but they don't continue to sustain the process. So that's become a challenge. Another also experience from Malawi, and yeah, the training and the triggering and the sealed process goes through. And then where the community have struggled with solutions like collapsing soil, and bringing up solution like cupboard sanitation. Then once we do the demonstration and the training and the support to the community, then they are able to adopt. And then there is very strong support from the traditional authorities who are our people on the ground, and the district mechanism or supports the community to adopt the sanitation approaches. So you find in those two areas where there is support from the local government, then the adoption and the sustainability is possible. But when there is standard and there is no support on the ground, in the case of West Africa, Cote d'Ivoire, then there is no continuity and there is no sustainability. Yeah, so I've seen those kind of experiences. Thank you.
So we need champions at the local government level. Yeah, it's about how do we foster those champions and replicate those champions, and I suppose not just we need people to be putting. It's going to be a tough journey to safely manage sanitation, and how do we not just work with the champions, but also other people who aren't champions but can still do good enough work to get us there. Yeah, no, it's a tough road ahead, but we're trying to identify what those how we can foster those champions at that level to better support communities on the journey towards ODF and safely managed sanitation. Yeah, and in the Nigeria example, they also mentioned the traditional leadership and working with both. I think something else which comes across many of the examples are the different types of government, so both the technocrats and the political. And Emma was talking about working with the parliamentarians at the county level. We have the traditional leadership, which was very important in Nigeria, and in I think Zambia, they also have good examples of engaging with traditional leadership to support the journey towards ODF. I think we've run out of time. Just a couple of points to wrap up is that if you are interested, come and give me your email address, and we do have a number of resources which have been produced, or a number of papers which have come out of this. So we have a summary report of both the West Africa and the East Africa process, as well as a paper which was published in H2O, which is looking at how to galvanize local leadership based on the examples in Kenya, Uganda, and Rwanda. And that was a paper which was very much co-written by local government actors and development partners, as well as researchers based at the Institute of Development Studies. And then we're hoping to run similar processes in Pakistan and Cambodia. So if you work in Pakistan and Cambodia and are interested in engaging at all in a third and fourth round of this, as we try to build experiences from different parts of the world, do let me know. But thank you to Emma and Mabel for your presentations, and to our virtual presenters as well. And thank you all for staying with us. I hope we delivered and met all your expectations. Yeah, thank you. And we're around to come and talk to us. And we have a poster presentation on this as well. So if there are any other comments or thoughts, please do reach out. A lot of information about all the case study sets. What organization do you work for? Ah, cool. Okay. Yeah. That one.
I give my name to. Oh, I'm sorry, I don't have a business.
Yeah.
Yeah.
I mean, it's very informative.
Yeah, no, that's.
Sorry? Oh, there's a presentation.
Yeah, thanks for that presentation. Yeah, there's another other counties that you're working in.
I work in Sia and.
What are the other 15?
Yeah, the other countries, quite a number of them.
Okay. Oh, that's the other one.
But
not.
Yeah. What about you?
Institute of Finance. I'm from
Yeah.
the United States. And we've been working with, or rather the city. It's kind of a different context. It's urban sanitation, so the city ministry. And the utility in Glasgow.
Other works in the school and in the field and how we kind of position ourselves.
But the governor has tried. The governor has tried so much.
We don't.
His name is now clean.
Yeah.
It's really unusual.
They're
Yes.
male out of progress and
And it's really.
eager and motivated, move forward.
So it's very interesting. Yeah.
I wanted to.
But thinking.
So-
Yeah.